Hello everyone. Today I'm going to compare ibuprofen or Motrin with acetaminophen or Tylenol. I'm going to let you know when you should take one versus the other, what the side effects are, and which one might be able to help you the most. So stay tuned. I'll be right back.
Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
So if you're in pain and you go to the grocery store, what should you buy, Tylenol or Motrin? Are they the same? What are the differences? Well, first of all, they are not the same. Tylenol or acetaminophen does not work for inflammation. That means that for indications where inflammation is involved, you really wouldn't want to use Tylenol for that. Now, let's talk about some other differences. Ibuprofen is a non-steroidal anti-inflammatory drug, so it is good for inflammation. It's good for toothache pain. It's good for sprains, any kind of swelling in your joints. It's good for pain like that. But the problem with ibuprofen is it has more side effects than Tylenol does. If you have liver disease, you want to stay away from Tylenol. If you have kidney disease, you have to be careful with how much ibuprofen you take. And if you take ibuprofen for long term, it can actually harm your kidneys. One dose here and there probably not going to matter, but if you take it a lot, and some people do, it can harm your kidneys. Another thing about ibuprofen that you need to be aware of, it's hard on our stomachs because it causes irritation in the stomach, and it's a COX-1, COX-2 inhibitor, which I'm not going to go into that, but the COX-1 has more effects on the stomach lining. So if you've already got stomach problems, ibuprofen can make them worse. And that's also why we always recommend you take ibuprofen with food. And of course, the higher the dose, the more problems you may have with your stomach. Ibuprofen can cause bleeding. We have to be careful with that as well. So, what about fevers? Really, they're about the same. Tylenol and Motrin are about the same for fever. And some kinds of pain, like headache pain, can also respond to either one. If Tylenol works well for you and you don't have liver disease for headaches or for fever, then that's probably a good place to start. Because like I said, ibuprofen has more side effects. All drugs have side effects. Tylenol, you're basically looking at nausea, vomiting, and it may cause headaches in some people. Whereas with ibuprofen, like we talked about before, it can cause bleeding, stomach irritation, can hurt your kidneys, and it can actually also have some pretty severe heart effects or effects on your heart as well, especially if you take it long term. It can cause strokes, it can cause heart attacks, it can cause atrial fibrillation. So we need to keep all of those things in mind. That being said, at least for me, ibuprofen works better. Now, here's another thing that I want you to be well aware of. You can use both of these drugs at the same time, but you don't take them at the same time, so you can rotate them. So both drugs have a maximum dose, and you know how many times you want to take them per day. It's usually every 4 to 6 hours. But you could actually take the ibuprofen And then a couple hours, 2 to 3 hours later, you could take the Tylenol, and you could keep doing that. And that can help minimize side effects for one, and help you keep your dosages of each drug lower. Now, we're assuming when you do this that you don't have liver disease and you don't have kidney disease. If you're a healthy person, you can do this. What about kids? Well, this is one of those things, you can do the same thing in kids, but what I'm going to tell you about children is make sure that you check with a doctor or pharmacist before you give anything to your kids. I mean, if you look at the back of the box and it tells you that, yeah, it's okay to give a 2-year-old or a 4-year-old, and you can look at the doses and figure that part out, that's great. If your kid's weight does not appear on that box, call your physician. Don't just assume that if they're 6 months old that they can still take it. They might be able to, but what's the dose? Because sometimes all the doses are not on the boxes. So check with your doctor or pharmacist before dosing your children. I will tell you, what about brand versus generic? This is another thing that I think is important to know. The biggest difference between brand and generic of these drugs are brand name Tylenol liquid for kids tastes better, so you're probably going to have a better chance of getting your child to take it. That's really the only difference. Drug's the same, but the generic brand may not taste as good, and you don't want your kids spitting liquid Tylenol in your face. I don't know for sure if that's true with Motrin or not, but I definitely know that with Tylenol, that is the case. So I hope you've enjoyed this video. If you have any questions about pain relief medications, please leave them in the comments. If you know somebody that wants to know more about this subject, please send them this video. Give me a thumbs up if you like the video, and please subscribe to my channel for more happy, healthy living information. My name's Pharmacist Michael, and like I always say, be happy and be healthy.